This is Lauren Mullinax and Jessica Muni from News Channel 7 bringing you the latest news on melanoma skin cancer.
There have been many new reports coming in on the origin of melanoma skin cancers, and with the summer coming to an end, it is particularly important that you think about getting a routine skin check from your doctor.
Skin cancer is by far the number one cause of cancer, and while melanoma only accounts for about 1% of skin cancers, it is the deadliest and the highest mortality rate in the U.S. is continuing to rise.
It is widely assumed that melanomas are malignant transformations of moles. However, this is actually not the case. A recent article found in Medical News Today explains that most melanomas grow as new spots, not from existing moles. About 70% of melanoma cases are new skin lesions, and only about 30% arise from moles already found on your body. So it is especially important to be on the lookout for any new spots on your skin that weren't there before.
So what is melanoma? The article further explains that they are caused by mutations in the skin pigment cells due to DNA damage, usually from UV light exposure from the sun or tanning beds. It is more serious than other types of skin cancer because they can metastasize to other parts of the body.
So who is at risk? Melanoma is 20 times more common in whites than in African Americans. Your risk from melanoma also increases as you age, with the average age of diagnosis around 63 years old. Other risk factors include a positive family history of melanoma, a weak immune system, having fair skin, or having more than 50 moles on your body.
Where do we find the greatest incidence of melanoma? Research done by Ali and his team found that the incidence of melanoma is greatest in regions closest to the equator. The incidence is increasing in the U.S. and other countries with fair-skinned populations.
And when exactly is all of this happening? In the United States, the rates of new melanoma skin cancers have been increasingly approximately 1.4% every year over the past 10 years. In the year 2017, it is estimated there will be approximately 87,110 new cases and 9,730 deaths from melanoma.
How does this all tie into epidemiology? In developing an epidemiological triad for melanoma, we as humans would be the host, the physical agent would be UV light exposure, particularly UVB, and the environment would be locations close to the equator.
Now let's talk about prevention. Research done by Ali, Yosef, and Yarkin suggests several preventative strategies. In terms of primary preventions, stay in the shade, especially between the hours of 10 a.m. and 4 p.m., avoid tanning beds, and wear broad spectrum sunscreen as that of SPF 30. Apply your sunscreen thicker and more often than you think you should. Secondary preventions include undergoing regular skin cancer checks with your primary care doctor or dermatologist and doing monthly self-exams at home, looking for any ugly duckling spots. And if melanoma is diagnosed, treatment such as excision, radiation, or chemotherapy would be involved in tertiary prevention.
Thank you for watching this special edition report, and remember, an ounce of prevention is worth a